We're going to go to coding. I am Thomas Waller. I'm assistant professor of family medicine. I'm the family medicine residency director at Mayo Clinic, Florida for family medicine. Just finished my first year and graduated, well almost have graduated 6 residents at the end of this month. And we're going to talk about coding and how to make more money. Who wants to make more money? Raise your hand. Let's go. Okay. So, no disclosures. I wish I had disclosure. I'd make more money. But so always start with this slide. Although coding guidelines should never affect how we give individual patient care or how it's delivered, understanding the requirements is essential. In other words, we're not trying to game the system. We're not trying to cheat the system. We're not trying to skirt things. We want to make sure we understand the rules so that we can get maximum reimbursement for the work that we're doing. So talk today is just going to touch the tip of the iceberg there, because there's a lot of things we can do to improve our productivity for all the work that we're already doing. Just a couple of interesting facts. The Center for Medicare and Medicaid Services processes and pays 4.4 million claims a day. Just imagine 4 million claims coming in every single day. Because just think of everybody that's in this room or at this conference and how many patients did we see a day, you know? I mean, 20, 30, and then just across the country. It's worth over $1 billion per day. 481 billion per year is what's estimated. Now, they have a lot of screening mechanisms. So a lot of things, you know, people are concerned about being audited. I'm going to get audited. Okay. Most of it is just mechanical edits and automated, because obviously you can't look at 4.4 million claims, and most things are just paid straight out. They're just paid. Comes in and is paid. And per year, less than 0.3% of submitted claims are actually reviewed. So if you feel like you're going to win the lottery, you might be audited. But if you code incorrectly consistently, whether it's too high or too low, you'll be recognized, and you'll begin to be pushed out, and they'll say, hey, this person just doesn't know how to code properly, and so we better go evaluate this person. So what we want to do is code properly, but perhaps have a little bit less fear of always being audited, because, boy, a lot of claims go in every day. That doesn't mean we're trying to not do something we should, but just keep that in mind. In 2000,